I think this is an exciting time. I think, both of these drugs, Ibrutinib is a little bit easier because it has the FDA approval in terms of getting it approved for a patient to actually use. Ruxolitinib can still present some challenges in terms of getting insurance approval for patients since it's not FDA approved yet. So there's often a lot of prior authorization loopholes to go through. So, always making sure to take into consideration for your patients not only the actual efficacy of the therapy, but also some of the other challenges that come along with treating these patients. So there is a lot of financial toxicity that comes along with these. So making sure that, the patients are able to afford them, even with insurance. There can be really high copays. So trying to do a lot of that investigation before you actually start the therapy and commit someone to it, I think is really helpful. These agents also have a lot of potential concerning adverse effects. Infection is a really big one, particularly with the Ruxolitinib. Cytopenias with Ruxolitinib can also be challenging. And then Ibrutinib has some cardiac side effects, and they actually had about almost 25% of patients in that trial I mentioned had to discontinue Ibrutinib therapy due to adverse effects. So I think that's a great place for pharmacist intervention to be able to help manage those and be able to work with, whether we need to do dose adjustments or hold therapy or change therapy completely. I think that is really important for pharmacists to be aware of as we're trying to use these new agents.